Hi, I'm Monica. I'm your nurse today. We're going to be doing the head to toe assessment. First, I'm going to be asking you about the general survey, and I'm going to start with the level of consciousness. So can you please state your first name?
Silver.
And where are you right now?
The communications building in the classroom.
Yes. What time of day are you here?
Evening.
Okay. And who's the president?
Obama.
Yes. So, or in oriented times 4. Now I'm going to be checking for your mood and affect. You seem to be at ease, calm, appropriate for the setting. Then I'm going to be looking for your posture and your position, and you seem to be erect and holding yourself up with no accessory muscles, and your hands are in your lap. Okay, and then going on to your your hygiene, and I don't smell any distinct odors, and you're well kept, and your makeup looks great today. And then your age. You can state your age.
24.
Okay, very good. And your nutritional status.
I would say moderately healthy. I try to eat healthy overall, but sometimes I slip.
Okay.
Your phone's weak.
Yeah, I understand that. Okay, next I'm going to be checking your vital signs. And that is your temperature, blood pressure, pulse, and respirations. And for temperature, generally around like 98.6 degrees Fahrenheit. Pulse would be around like 62, and respirations 12, blood pressure 120 over 80 in that general area. Can you please state your height and weight?
I am 5'2", and I'm 130 pounds.
Okay, and your BMI, which we already checked up earlier, and you're 24. 25 is generally overweight, and 30 is obese. Just so you know that. And then we're going to be looking at your head and your face. So looking at your skull contour, you're rounded, and you're firm, okay? And looking at the symmetry of your eyes and your nasal and your mouth and your eyebrows are all symmetrical. And then I'm going to be feeling your axillary here and your frontal sinuses. Any tenderness?
No.
No?
No.
Okay, so no tenderness noted there. Then I'm going to be looking for your TMJ. So I'm going to be place my fingers right here and open and close. Any pain?
No.
So no pain with TMJ noted. Then I'm going to be looking at your CN5 and 7. So can you squint your eyes for me? And raise your eyebrows. Smile. Bare teeth. And puff cheeks. Pop. Good. So CN5 and 7 intact. Then going to be looking at your lymph nodes. Okay, so your pre and post auricular lymph nodes are right here. Any swelling? Tenderness?
No.
Okay, I don't feel any swelling. Okay, and then I'm going to be looking at your supraclavicular lymph nodes. Any tenderness here?
No.
No? No swelling. Your submandibular lymph nodes here. Any tenderness?
No.
No? Okay, and your submental tenderness?
No.
No swelling noted. And your cervical chain nodes right here. Tenderness?
No.
No? No tenderness noted. Okay, very good. Next, we're going to be moving on to your eyes. And I'm going to be looking at your pupils and to see if they are equal and round, which they are, and if they're reactive to light. Very good. Okay, and I see it constructs with light. That's good. And I'm going to be looking at your conjunctiva, which is right here. Moist and pink. And then your 6 cardinal signs for the CN 3, 4, and 6. So just follow my finger. Good. Okay, so CN 3, 4, and 6 are intact. Now I'm going to be doing your ears and looking at the placement of your ears. And so I would have to say they are bilaterally symmetrical on your face. Then I'm going to palpate the pinna and the tragus. And yours is pierced right here. Okay, so they're firm and intact. Then I'm going to have the otoscope, and it's going to be upside down, and I'm going to pull your ear, your pinna back and up. And so I have my pinky like this, hold it upside down, up and back, and look inside of it. And to see if you have any exudate or the tympanic membrane, which is going to be a pearly gray color. Okay, and next after your ears, I'm going to go on to your nose, and I'm going to see if your nasals are symmetrical. Okay, and your mucosa is moist. And for patency, can you hold one side and breathe out the other? Okay. Very good. And then I'm going to be looking at your septum to see if it's deviated. Okay, so your septum is not deviated. And your turbinates, which are the ridges in your nose, and that is when you breathe in, those moisten and warm up the air so it's not so harsh and cold and dry on the back of your throat. Okay, so those are a darker pink color. Now moving on to your mouth. So can you open up your mouth for me, looking at the mucosa? So you are pink and moist. Very good. And stick out your tongue for me. Very good. Midline, okay. And your teeth, smile. They are white and straight. And let me see your ear overbite. Okay, very good. So your top teeth go over your bottom teeth, which is good. And then I'm going to be looking at your uvula in the back. Okay, it's intact and dangling, and your pharynx in your back. There you go, thank you. Very good, which is moist and pink as well. And then looking at your CN10, which with your tongue depressor, I will put on your tongue and make you say the ah noise, ah, and that is where your soft palate is going to rise and your uvula will shake, which is generally good. And then your gag reflex, which we won't do here, only in a clinical setting. I won't gag you right now. Okay. Okay, so after the mouth, I'm going to be moving on to your neck, and we can't do this right here, but generally you would be at a 45-degree angle. So just to show a little bit, just go back just a little bit. Okay, so I'd be looking right here to see if any distension or any abnormalities right here, and I don't see anything, so no JVD noted. Then I would be looking at the carotid and feeling it right here and here. And you don't want to do them at the same time because you don't want to pass out. But they're bilaterally symmetrical, and I would say 2+. If I was listening to them with my stethoscope, I would say no bruise noted. Okay, and then after that, I'm going to palpate your trachea. Any tenderness here?
No.
No? Okay. And I would say it is midline. Very good. And after that, I'm going to check your CN11. So can you shrug your shoulders for me? Very good. And your range of motion for your neck, which is, can you look at this way? This way? Up and down. Now, ear to one side, ear to the other side. So you have full range of motion with that. That's good. Okay, so now after the neck, I'm going to be moving on to your heart, and the 5 heart sounds I'm going to be listening for are your rate and rhythm, your S1 and S2 together, S1 and S2 separately, extra sounds, and a murmur. And your 5 placements, I'm not going to put my ears in because I want to be able to talk to you. So you have your A, P, E, T, and M. With your aortic placement right here, that's going to be your second intercostal space with the right sternal border. Your pulmonic is your second intercostal space, the left sternal border. Erb's point is your third intercostal space, left sternal border. Your tricuspid is your fourth or fifth intercostal space, your left sternal border, and your mitral right here is your fifth intercostal space, your left midclavicular line. Okay? So done with your heart sounds. Now I'm going to be moving on to your lungs. So do you mind turning around for me?
Sure.
Okay, and I'm going to be doing the thoracic cage expansion. So I'm going to put my hands here. Can you breathe for me? Deep breath. Very good. One more time. Very good. And I just want to see that they do expand. So your lungs are bilaterally symmetrical. Next, since you're turned around, I'm going to do the 18 placements on your back. So I'm 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. And the reason why I curve up at the ends is because you have a shorter torso, and so I don't want to get too low down here because I want to hear just your lung sounds. Okay, can you turn around for me? And I'm going to be doing your anterior sounds. And there's 10 in the front. So 1, 2, 3, 4, 5, 6, 7, and 8, 9, and 10. Okay, and after that, I'm going to be looking at your right, which you have 3. So I'm going to come over here, lift your arm if you're okay with that, and listen for your 1, 2, and 3. Your 2 is more in the front because that one is in between the 2 here, so it's kind of pushed towards the front, and the third one's towards the back. And your left only has 2 spots, so the placement for that, lift your arm if you're okay. 1 and 2. And if I was really listening with my stethoscope, I would note any adventitious sounds, such as wheezing, stridor, rhonchi, or rales, which are all not very good. Okay, so moving on, we're going to go to the abdomen. So if you don't mind laying down for me. Okay, and I'm going to bring your shirt up real fast. Okay, so the general contour of the abdomen is relatively flat, okay? Then I'm going to be listening for the aortic pulsations, and generally for a thinner patient, they're going to be stronger. So we'll see right here. And you have faint aortic pulsations. Next, we're going to be listening for any bowel sounds, and you're going to start in your right lower quadrant, then move on to your right upper quadrant, left upper, and left lower, going around. And if I didn't hear any sounds, I would do 5 minutes in each quadrant just to see if I could hear anything. And if I didn't, then I would be a little more worried about that. And then I'm going to palpate, okay? Any pressure?
No.
Okay. Good. So you're soft, which is good, and you're not firm. Okay? So you can sit back up for me. All right, and now looking at your lower extremities of your legs and feet. Okay, I'm going to be looking at your hair here, and you are shaved. Edema, you have no swelling. Capillary refill, going to squeeze, and you immediately return, which is very good. Okay, then I'm going to ask you to, I'm going to palpate your heel to see if you have any tenderness here?
No.
No? This one?
Nope.
No? Okay. Feel them together. Very good. Okay, so your dorsalis pedis pulse right here. Bilaterally symmetrical, 2+. And your posterior tibial pulse right here. And they're bilaterally symmetrical as well, 2+. And now I want you to dorsiflex up and plantar flexion down. Very good. Now range of motion. I want you to stand up. And can you bend your knees like this? Very good. Okay, you always pop when you do that. Okay. And now with your ankles, can you go inversion, eversion, and then dorsiflex, plantar flex. Next one, inversion, eversion, dorsiflex, plantar flex. Very good. Now I'm going to look at the symmetry of your hips and your knees and your ankles together, and they are bilaterally symmetrical, which is very good. Okay? You can be seated now. Okay, and after that, let me think a little bit. I think I might have gotten out of order. Let's see. I didn't do the upper extremities. Okay, so hold on, let me think for a second. Yeah, upper extremities. Okay, sorry, looking at your nails. I can't remember this one. They're rounded and pink, and they're not cyanotic, which is very good, no blue. Okay, and your radial pulses, bilaterally symmetrical. Turgor retracts immediately. Oh no, I did do this, because you did C11 with your shrugging shoulders. So, I mean, we'll do it anyway if I forgot. So, C11, can you shrug your shoulders? Okay, very good. So, C11 is intact. And then range of motion for your arms. So, can you go out, up, and flex? Okay, good. So, full range of motion for your arms. And I'm going to look at the symmetry of your shoulder and your wrists and your fingers. And they seem to be symmetrical, bilaterally symmetrical to me. Okay, very good. And then for grips, can you grip my fingers as tight as you can? Very good. Okay, so your strength is bilaterally symmetrical. And for my arms, grab my wrist, and I'm going to give some resistance, and you just push and pull. Very good. So your strength is bilaterally symmetrical as well. And then, okay, I think I hit there, and now going on to neuro. Can you do this for rapid motion? Very good. You touch each finger to your thumb. Good. It's okay. And then can you stand up? I'm going to inspect your spine. Okay, so go this way and bend over. Checking if your spine is midline. Okay. Very good, your spine is midline. And then you can stand back up. Okay, and now I'm going to be checking your gait, so can you walk down and back? So you have smooth open gait and your arms swing by your side smoothly, which is very good. Now I'm going to be looking at your skin. You're white and you're fair. The moisture, you are relatively dry, and your temperature is bilaterally symmetrical on both sides. So your temperature is good right there. And then all throughout the assessment, I've been looking at your skin and seeing if you have any lesions, bumps, scars, anything throughout. And I have not noticed anything, so no lesions, bumps, scars, or anything different there, which is very good. And the last thing is, can I see your nails again? Just to see the pink, rounded, groomed, and they're not blue, so you're not cyanotic. Very good. Trying to think if I forgot anything. Let's see. I think I covered most of it. I think you're done. Thank you so much.
Okay.